There's your $5 fine. Thank you very much.
All right. We've got a couple of folks that I thought are going to have a fascinating program for us. Now, I'm not, Phil, sorry about that. I was going to wear my cat and hat, and then I saw these guys wearing their vests. I thought, this is the most color I could come up with. And it's actually not Bolivian, it's Guana. So, wrong continent. Sorry. I should know better, Meredith, but it was the best color I could have. But we've got a couple of guys that went on a mission trip. It was sponsored by the Methodist Church, both these Methodists. They didn't have to be Methodist to go. We have Rex Largent and Doug Wilsey. A little bit of background. Rex is graduate of Kansas State University, civil engineering. He did some time in South America, at Venezuela and Middle East, doing his work projects. He's retired to Stillwater, real involved in the Methodist Church and a lot of its programs. Doug Wilsey is a Stillwater High School graduate, Oklahoma State University graduate. Of course, many of you know, medical doctor. He got his degree at University of Oklahoma, and he practiced 10 years in, the general practice, and then the balance of that was in emergency room. So without giving you too much further ado, I'd like to turn it over to these guys because I know they have some excellent slides and a lot of comments about what they were doing way up high in the sky. Who should I turn it to? Rex?
So Butch and I were socializing at some event some months ago, and I was telling him a little bit about this trip, and I turned my back, and about 5 minutes later I get this email, and he's already sent it to Chris Norris or somebody saying, so this is going to be our program such date. So there's no pressure felt here. It's just like half of our church is here to fact check us. And if that wasn't enough, you brought in the CIA to make sure we so. No, it's our pleasure to do this. This trip this year was from many years of the church sponsoring these trips. So the Oklahoma Conference, the United Methodists, partnered with the Bolivian Methodists back in the early 80s. And I'm told, Roger probably knows better than me, but I think that was a follow-up for some individual missionaries efforts down there, and that our church started that mission work in the 80s. I think talking to Doug Valley, who was our mission leader, he named off. He thought that Earl Mitchell went down there in the mid 80s, so that was maybe a community member you'd recognize that went early. Mr. Gose has gone a number of times. Some of you know Ray Kinnanen. Ray Kinnanen's been down there. So our mission group that I have listed here, about half of us are from the First United Methodists, and the rest of them are from other churches out of town, people that have a heart for the mission work and have some talents to bear to it. Just for background, Bolivia's kind of landlocked country down there with the Andes and the high plateaus and the western third to half. It's about around 12.5 million. As with a lot of those countries, the major populations in the urban areas, with La Paz being 2 million. The makeup of the folks there. About 70% mestizo and 20% indigenous. Of those indigenous, it lists here that there's 37 groups. Kind of reminds you of North America, doesn't it? And then out of that group, really, there's two major groups, Aymara and Quechua. So we dealt primarily in this that upper blue. The northwest areas where we were at exclusively. This gives you a little bit feel for the terrain. So we arrive in Los Altos, which is a suburb of La Paz, and we land at an airstrip that's 13,000 feet. I think it's the world's largest or highest commercial airstrip. And then we get a reprieve going down to La Paz at 12,000 feet overnight there, and then we leave La Paz, go back through Los Altos, down through the valley bottom where Lake Titicaca is, and that's about 11,000 feet, and then we climb up into the mountains to go over a pass at 14,500, and then go down to another valley that's 10,500, and eventually make it to the Kapaiki where we did our mission work. And it's a little over 11,000. So we were never at an elevation lower than 10,500 feet. So yes, altitude is an issue. So one of the key things that our church does is provide financing for projects and things that they need down there. That first vehicle there, Toyota Land Rover, was funding provided by the church for them, and the clinic that we're going to talk about later is the funds were provided by the church to build. And so it's the mission trips are medical and construction projects focused. So at this point, I'm going to let Dr. Wilsey. He's got a little bit better information than I do.
Thank you, Rex. I knew that trivia question about Jackson Jennings. I've been dealing with asses for a number of years. I've got 3 miniature donkeys and a regular donkeys, and you'll see donkeys in the developing world wherever you go, whether it's the Caribbean or Central America or South America. Also, I was interested to hear Dylan say that he threw shot. Back in 1966, back in the old days, if you did fall sports, the athletic club said you had to do a spring sport. Well, we didn't want to do spring sport, but Greg Sherrill and I, since we did football in the fall, we had to do a spring sport, so we did track. And we threw the shot too, but the only suspense when we threw the shot was whether he was going to be last or I was going to be last when we went to the track meets. So I admire somebody who can throw the shot, because we could not. Let's see, and okay, now how does this work as far as that advances? I am an internet retard, so I appreciate he tells me to press this button. Okay, I'll kind of go through these. This is the trip from when you leave La Paz, which is the big capital, and this is a stop along the way. One of the you can see in the river there are people washing their clothes. The further and further you get away from the big cities, the more and more poor it gets. And yeah, this is near Lake Titicaca, the highest navigable lake in oh, this is as the crow flies.
Yeah, it's many hours, but yeah,
3 or 4 hours.
lots of switchbacks.
Yeah, lots, and you're going. It's the most beautiful place, but the second poorest place in the world, Bolivia, beaten only by Haiti in our hemisphere. And then these, as you go up, you begin to see higher and higher in the mountains. You may not be able to see it, but there are
That's what we saw every morning when we stepped out of the clinic.
Yeah, you see, the Andes Mountain is just unbelievably the world's prettiest real estate, and this is where we sleep up at the top of the medical clinic. You can see the sleeping bags there, and so that's some of the conditions that we sleep. Here are two cooks, and they have to pack everything up there to feed us, and they're just absolutely wonderful people. These are our translators. When we go up there, you think, well, it's going to be Spanish, and it largely is, but it's Amari also. The Indians are called the Amara Indians, and they speak Amari, and they're one of the two biggest tribes. There are, what you say, 37 tribes or something throughout Bolivia. Many of the smaller ones are down in the Amazon, but the Amari are the second biggest. And so we have translators that speak Spanish, but often you'll have to translate from the Spanish into the Amari because many of them don't speak any Spanish at all. And it's curious, a lot of times making decisions, well, which medicine will we use? Well, how old are they? And I ask them, how old are they? They don't know. I said, well, how about your children? How old are they? They don't know. They've lived up there and died up there for years, a number of years, well, for thousands of years, or at least since about, they think about 5,000 AD that they eventually migrated up from along the coast up into the higher elevations. But many of these people certainly don't have driver's licenses, but many of them don't have birth certificates. More and more they do now, but some of them have lived and died and go unnoticed as far as history because they don't know how old they are. The younger ones often do. This is church on Sunday mornings. We often have church in their little church there, and this is right afterwards. You can see a number of us that are in the team and some of the Bolivian people there are very typical looking. And this is kind of a neat thing they do every year. They bring their best for us. They absolutely treat us like royalty. Their life is the same year in and year out, day in and day out. But every now and then, once a year, the Americanas from the airplanes will fly down there and bring them a little bit of hope and a little bit of medicine and a few trinkets. And they will bring the best food that they have and they lay it out. This is their welcoming food that they will offer. And there's like 30 different types of beans and potatoes, corn. There'll be very little protein. You know, there may be a few eggs, a little bit of goat meat, but there's just almost no protein in their diet. But it's really very nice, and we're expected to, eat there from the foods. This is just one day we pack medicines. We have a medicine supplier in Tulsa called Blessings International that can get medicines for about 10 cents on the dollar. And the medicines are good medicines. They're what the European Union uses, Germany and France and Great Britain. It's the same. They're manufactured in India and other places, but they're just not, they don't go through the rigorous, expensive quality control of the FDA here. So we buy our medicines, but they come in big bulks of like 1,000. And so if we're going to hand out, say, 30 vitamins to somebody or 30 amoxicillin, 250 milligram penicillin pills, we put them in little packets. That was one of the days. Again, a picture outside of the churches there on Sunday morning, and I think those are a lot of the members of our team. See, there's Rex standing up there, and Don Crawley, and I don't know of anybody else. Here, they come to the clinic, they check in. Carolyn Williams is in the white hat there. She's from Pawnee and was the best nurse we had at the hospital for decades. She worked up in 3, and she has gone for many, many years, far more than Rex and I have. And then these are some of the people lining up outside to go in the clinic with the translators there, and they'll check their blood pressure, if there's a question of diabetes, their blood sugar, and will basically deal with their complaints. Now, complaints in the developing world, medical care is really different than in this world. You know, if you had severe bad flank pain and you were peeing blood and bent over, you think, well, I've got a kidney stone. I'll go to the ER and we'll do a CT scan, and you might be referred to a urologist. Maybe they do lithotripsy. Or if you came in chest pain, you'd have a lot of blood tests done. The cardiologist might come put a stent. So there's a focus on diagnosis and referral. In the developing world, there's not. basically, when you get out in the remote areas, it doesn't matter what the diagnosis is because there's nobody to send them to. There's no functioning healthcare system. They do have a government healthcare system, which is, it's a poor country, so they can't take care of their population. They do the best they can, but it may be weeks or months before they can be seen. For instance, when we were there, we saw a 75-year-old lady who had fallen, and her shoulder was all swollen, and she'd fallen a second time, and she couldn't move it. So she probably has a fracture of the head of the humerus. That's a common fracture. Well, there's no x-rays there. There's no CTs. There's no bone doctors up there. So the best you can do is put her in a splint, and most of them do pretty good. A 4-year-old came in. It was doing pretty good, growing, and then about 2 years ago, quit growing, and just was little and wasn't eating and would turn blue when he ran or played. And we listened to him, had a really loud heart murmur. Well, the kid's got congenital heart disease. And what's going to happen to him? Well, he's going to wait months or years to be seen if they even take him to La Paz, a 5-hour drive away. There is private health care, and you can short-circuit things if you have money. But believe me, these people don't. They live on subsistence living. They work up in the hills for 6, 8, 12 hours a day, whether it's tending their goats and sheep or their potatoes or corn like that. So they work, and you can see they're little tiny people. There's the Bolivian flag, a real typical. They're small people, real big, barrel-chested. They've evolved due to the high altitude. So a lot of the people you see, you think, gosh, and it took us a while to adjust to that. It doesn't make a lot of difference to go through the algorithm of if it's this, do this test and that test, because it's a moot point. There's nobody to send them to. Another one we saw, a 30-year-old female that came in. I don't remember what was the trivial problem, but she had 8 children, and she's 30 years old. So obviously contraception's a good point. And they do that. They do have Depo-Provera, where they give the Depo progesterone shots. We saw families that would walk 2, 3, 4 hours just to get some Tylenol, just maybe to get some eyeglasses, because it may be their only shot at giving them until the next charitable group comes. This is Don Crawley, just with one of our patients, and Danny there, one of our translators that speaks both Spanish and Amharic. I don't know the nature of that visit. And here on reading glasses, that's we were there, and the little old people would come in, these little ladies would come in, and they're spinning their wool, but they couldn't see. So I'm sitting there with my reader eyeglasses on, and I hand her the eyeglasses, and her face lights up. She smiles, she can see. So we started going to the Dollar General store here, buying eyeglasses, and you can get them also through Blessings for about $1 each, maybe a little bit more with inflation now. But that's a big deal to people who are 45 or so, especially the women who would do a lot of needlework and work with llama wool and sheep's wool. But also, there are no optometrists, no ophthalmologists. They're not going to see any eye doctors there. And so they have developed for about $20 a type of glasses that are good for distance vision. They'll go up to about $20 to $50. They have a little worm wheel thing that you rotate, and it rotates the lenses so they can, both right and left go up to about. So that's another thing. So eyeglasses are real important. We'll mention maybe later on sunglasses. Here they're looking at some sunglasses, and those are the adjustable distance visions in sunglasses. And you think about sunglasses, hey, isn't that a little silly to take sunglasses up there? Well, sunglasses are real important. These people, again, no UV violet protection. They work 10 hours a day up at high altitude, and the sun's much brighter as you go up higher. It's much, much brighter. And they're constantly getting trauma. Their eyes are getting hit with dust or objects that are flying. And eye complaints are one of the most common. Dry eyes, irritated eyes, red eyes, that's one of the most important things. And whether you're in a tropical place like Haiti or whether you're in the high altitudes, the problems they have are similar. They're related to living outside. They work outside. It's subsistence living, so they're exposed to air and wind and sunlight. Well, sunglasses, as it turns out, due to stopping all the repetitive eye trauma and stopping ultraviolet light, greatly decrease cataracts. So $1 pair of sunglasses, again, seems silly to us, and the kids come and they're just proud as punch that if they get a pair of sunglasses, but we give it to the older ones. Here we're just seeing patients in the clinic, and there's our interpreter. This is a little lady, I can't remember. I think part of this is we're showing a blanket. Often University Heights Baptist Church here is really good about making bags. They call them joy bags and blankets, and we hand those out, and the little women up there, that's a real prize, something that they can use for years. Here's Cindy, our pastor, functioning in the pharmacy. We give out lots of medicines. We typically take about $3,000 or $4,000 worth of medicines, and Blessings is pretty smart. They got it color coded, where there's the sun, morning, midday, sunset, and then at night, and you can just put a 1. If it's 1 twice a day, for instance, on this Cipro, they might get 10 pills, 1 twice a day. If they have a bad urinary tract infection, a pelvic infection, diarrhea, or something like that. So we hand out an awful lot of pills, and we do it in this way. You don't have to speak the language because of these little packets that we hand out. Oh, here, yeah, this lady is getting one of our joy bags, and if you know anybody at University Heights Baptist, their sewing group, they just do a great job. They always want us to take their joy bags and blankets to serve. They also we have children activities. You think of a mission where you're talking medical, but Rex did one of the most important things. He and 3 of our other guys went and worked to put in a floor in the church, and it's just absolutely gut busting. At 11,000 feet, I could hardly breathe. Well, they, along with the other Amari Indians, built the floor of the church. So on these trips, there's construction, there's children's activities. Some of them are biblically based, a lot of them aren't. Little crafts and things like that, the eyeglasses. So it doesn't matter whether you're religious or whether you have any particular skills. You'll be surprised. You'll fit in, and the real effect of the team, you get very close to your team members. Yeah, here's some teenagers doing crafts and things. So there are a lot of things that you think might not think of. And this is the new church next to the old church. That old church, as you can see, the adobe bricks there. Well, the back has fallen out of that church a couple of times. There's Rex in front of it, and they were working on the construction. Yeah, here's the old church with the back that kept falling down, so the new church is next to it. And here's, Rex knows a little bit about this. Here are the big long boards, and look at the women in there. I remember one year we were building the clinic, and I had about an hour off, an hour break in between clinics. So these little ladies, Rex Kinnanen was there moving a mountain to fill in next to the church, next to the medical clinic. Well, these little ladies were out there with their aprons carrying rocks, and I said, well, hell, I'm a lot bigger, stronger than they are. And I went out there, and within 15 minutes, I was done, and they just went on for hours and hours. These little people up there are just tough as nails, and the women put me to shame. Here they are building their the floor of the church, and it was just amazing. Don't know. Yeah, here you can see at the end of the week they have a ceremony to thank us, and corn obviously is a big part, a big staple, and here they honor us by hanging these corn sheaths around us. I noticed that you started with the Pledge of Allegiance and a prayer. The Bolivians love their heritage, their Indian heritage, and they sing and dance. It's very important to them. We seem to be getting rid of our heritage, and I think that's a real mistake. I'm really pleased to see you guys start with the Pledge of Allegiance and a prayer to hang on to our Christian legacy and just remember in our country. Oh, this is a group of our team and a lot of the local Indian members there. And again, just a picture of a lot of the village people. And oh, this is back in La Paz. I'm going to skip through these pretty quick. They're hoping to have a mission next spring in April of 2025, and Doug Valley is over on the right there. He'll be looking, and he closes with peace or pause, and it really is up there. Let's see, now does it go on? Yeah, can we just real quickly all go through those others? I know we've only got about 5 minutes, and we'll be done. So they come and they just want relief from working 10 hours a day. Their backs hurt. They have headaches. They have gastritis. They don't get enough to eat, so they're always hungry. The gastritis is one of their big complaints. So giving them some Prilosec or some of the H2 blockers or something like that, or even antacids, are really important. So they come for symptomatic treatment, and this is here. You say that's 2017. There you are, Rex. Yeah, that must have been 2017. And I'll skip through these again. That was shown previously. Well, this is a brief trip. One of the trips that our church sponsored to Haiti, and Haiti got their revolution from Spain about the time we got the Louisiana Purchase in 1804. The French were awful to them. The average slave lived 20 years and were worked to death. The Haitians still are angry at the French. This is just another at one of our clinics. And again, here's Port-au-Prince. This is kind of what you see in the urban settings. Here is Go Naives, which is the minister and his charity that sponsors us. That's where we operate out of. We used to go there. We can't go anymore. As you may know, about 2 years ago, the president was assassinated. Haiti's had over 200 governments, some of them lasting days, some of them lasting months. It's thought to be one of the 5 most corrupt countries in the world, so even the World Bank won't lend them money generally. Here's what the people live in. This is out at Highlands, one of the villages that we served, and this is, it looks an awful lot like, I guess, sub-Saharan Africa might look, but that's what the people live in. This is at one of the clinics. Now this building is called Highland School, and it was built by the charity, and the charity is funded by churches in Missouri and Iowa in the Midwest, and this minister there has built a series of schools. Here's our 2019 mission there with Dr. Lloyd Moore handing out medicines and treating the people of Haiti. Real quickly, when you go, obviously you can kind of see you're living with $1 a day, typically 1-room house, dirt floors, no running water, no bathrooms, no latrines commonly. At the very beginning of this, you may remember the picture of Hispaniola. Haiti is the western 1/3, and Dominican Republic is the eastern 2/3. There's a straight line. If you look at it from space, it's brown in the western where Haiti is. It's totally deforested, and it's green on the eastern 2/3. You live 60 years if you live in Haiti. You live 70, life expectancy 70 if you live in the Dominican Republic. There are models of how they started their economy and their culture. I don't know, it's kind of hard to explain that discrepancy, but if you look at all the parameters, drinkable water, schools, paved roads, it's a lot better. Real quickly, and we'll finish up here, what's the silver bullet for reducing childhood morbidity? In Haiti, 5% of the children die by the time they're 5. That's 1 out of 20. And commonly it'll be from minor illnesses like diarrhea, along with anemia, maybe malaria, or they might get just pneumonia. But if they don't get their vitamins and iron, if the women don't in the last half of their pregnancy, and if the kids don't get it in the first 2 or 3 years of life, mortality is an awful lot higher. Here's a chart. Here's a slide that shows studies on vitamins and minerals even slows down HIV transmission and disease progression. I want to go back one slide. Malnutrition. The point is, what's the silver bullet? It's feeding. It's vitamins. Simple things like handing out vitamins with minerals in them, iron being the most common deficiency, and then zinc being second, make a tremendous difference. The kids' brains don't grow. They have cognitive problems. If they don't get vitamins, iron in the last part of their pregnancy and the first few years of their life, say the first 3, They're tinier people, they're growth retarded, and they have a lot lower intellectual function. So what seems like a simple thing to me, I didn't get it the first year. Why about all the vitamins? It makes a big deal in the developing world. Kids usually die not of one thing, but multiple things. They're anemic, they have malnutrition, they have diarrhea, and then they get pneumonia. So simple things like vitamins and minerals are super important. Here I'm not going to go through the eyeglass, but it's the same thing in Haiti as it was. And this talks about decreasing cataracts from eye trauma and ultraviolet light, the importance of that. So anyway, want to thank you all for having us, letting us share a real joy for us. We're jubilant about it because it's such a fun, it's such a feel-good experience. And we come away tired and exhausted and glad to be home. But then again, it's like childbirth. The next year, you're ready for it again. So, thank you.